We have a number of people here with us in Vancouver at Simon Fraser University, and I know that we have people from across the country who are also connected via the online system. So welcome everyone to this workshop, which will be focusing on the issue of preventing heat-related illnesses amongst seniors. And that's a topic that I became very interested in a few years ago when I did some work for Health Canada, actually looking at the impact of climate change and realizing that climate change does have implications very definitely for seniors. And it's been our experience in working with people also from the Stockholm Environmental Institute, where we did a survey of people from around the world, that many people who are over the age of 55 and many who are over 75, who really are the at-risk people, don't realize it. And they will think about climate change or think about heat waves in terms of people in third world countries, in developing countries. They will think about the 2005 heat wave in Europe. They don't think that this is an issue for us here in Canada. And so a major objective today in the Gerontology Research Center at SFU, co-hosting this event with Health Canada, is to try to draw more attention to seniors, to those who work with seniors, to those who work on behalf of seniors, about ways that we can prevent becoming victims of heat waves, because whether we like it or not, climate change is here to stay. And although today is not a typical summer day of what we've had, and it's a little cold, we know there could well be considerably more heat between now and wintertime. So I'd like to now call on Agnes Pekarsky from Health Canada, who's going to talk about some of the resources that are here for you to pick up.
Just do it again and follow the instructions.
Okay. Thank you, Gloria. Before I do my introduction, I'd just like anybody on the phone, if you are listening in via teleconference or WebEx, could you please put us on mute, but please do not put us on hold, because that will put funny music into the background. So if you could put us on mute, that would be great. That will cut down on some of our noise interference. I'm Agnes from Health Canada, and I'd like to thank Gloria very much and her network of seniors for making this workshop possible. We thank you for your support, and we're happy to have the opportunity to deliver our workshop this morning. And I just wanted to mention that I have a lot of the materials we will be talking about and referring to on our table here at the front on extreme heat. So if you haven't already, please help yourself. I had a whole bunch of CDs, but they are all gone. But if you would like another one, I could certainly send one to you or get one to you. And the other interesting piece that we have is we have an extreme heat online course, which is designed for medical professionals like doctors and nurses. And this is something that you can take at your leisure, at your desk, on your own time. So grab one of these cards if you're interested, if you haven't already. And now I'm going to pass it back to Christina to get started.
Great. Thanks, Agnes and Gloria, for putting this workshop together. It's great to be able to present to you guys here from Ottawa over the internet and over the phone, and for those who have logged in online, it's great to connect with you as well. I just wanted to give, before I get started, a little bit of background and information on our program here at Health Canada. So my name is Christina Simpson. I'm a scientist in the Climate Change and Health Office. And what we do here is we're working to create resilient communities in Canada from the health impacts from extreme heat and other climate change-related events. So as part of this, education and outreach activities are a big component of our program. Sort of like the workshop that we're doing here today, but we also do outreach to the general public as well as to other healthcare workers. As part of this program, We've also developed many information products. Like Agnes had mentioned, I guess they're there with you at SFU. But I'll also be discussing some of them today, and they are available online, free of charge if you're interested. And then finally, we do work with different communities to develop a heat alert and response system. So these systems are put in place to protect people within the community from the effects from extreme heat. So with that, I will get started here. So today I'm going to be talking to you about heat-related illness in older adults. In regards to questions, I guess since the lines are open, we'll probably have a question period maybe at the end of the presentation. I don't think it'll take too long, about half an hour, so I'm happy to answer any of the questions that you have then, and we just will open the phone lines. And you can also input questions into the chat box on the WebEx platform. So a little bit of what I'll be talking to you about today. So exactly what are the health impacts from climate change? And in regards to extreme heat, is it really an issue in the BC region? If it is, what are the regional health effects? Who's vulnerable? And how do we recognize and treat and diagnose heat-related illness in seniors specifically? And then I'll also touch a little bit on prevention, especially for long-term care facilities, what they can do during the summer months. So the causes of climate change. So it has been well established that the observed increase in the global average temperatures is due in part to the increase in greenhouse gas concentrations found in our atmosphere. These are produced through various means. And here, the Intergovernmental Panel on Climate Change did mention this in their 2007 report. So as a consequence of the changing climate, since the 1950s, the number of extreme events has actually been increasing worldwide. So as you can see from this chart, the frequency of temperature extremes, which includes heat events and wildfires, and they're represented by the yellow bars in this graph. They've been increasing since the early 1980s, which you can see is about halfway through the chart there. Other natural disasters related to climate change, specifically things like flooding in blue, and storms in green, have also been increasing in number. And we need to remember that since the release of this data, and this goes up to 2005, it was released in 2006, there are also other major heat events have occurred. So one of those recent events occurred in Russia. In 2010, Russia experienced an extreme heat event that lasted over 2 weeks, where temperatures were 15 degrees Celsius above the average for that time of year. So nearly 55,000 people across Russia died, which was thought to be due to the combined effects of the extreme heat and the high temperatures, but also the poor air quality. And that was caused by large brush fires nearby. So as you can see by the photograph on the right, here in the corner, you can see that the air quality during the heat wave, which happened on August 7th, 2010, the air quality was extremely poor. So this event was similar to the European heat wave in 2003, in which it's estimated up to 70,000 people died, most of them being seniors. So these types of catastrophic events with high morbidity and mortality are becoming more frequent. So is extreme heat really an issue in BC? So I'm often told when I go and I talk to people in British Columbia that extreme heat isn't an issue there. But in 2009, Vancouver and the surrounding suburban and semi-rural areas experienced an unprecedented heat event. So temperatures surpassed 34 degrees Celsius at the airport, and they were even higher within the city. And by comparison, so the 10-year average for Vancouver during that time period was only 21 degrees Celsius. So temperatures were almost 15 degrees Celsius higher than normal. So within days of the heat event, BC's rapid mortality surveillance system indicated that the deaths among residents in the greater Vancouver area had increased by about 40%. So with this, I decided to go back and take a look at the last 5 years in BC and see what the news headlines said. So in 2009, there were lots of headlines. In August 2010, another heat event blanketed coastal BC. This was in conjunction with wildfires, and it created both high temperatures and smog advisories in what Vancouver has usually very clean air. In 2012, another heat event came over the August long weekend, and that was also well documented in the news, as you can see here, which brings us to the current summer. So again, British Columbia shattered many local temperature records over the July long weekend. Temperatures reached up to 40.3 degrees Celsius in Lytton and 36.7 in Merritt. And these broke the oldest recorded temperatures that were set in 1924. So this heat event also stretched into the prairies as well. In Alberta, 20 regional heat records were broken on July 1st. And that was coupled with rolling blackouts in Red Deer and Edmonton because the electrical grid just couldn't handle the intense strain from air conditioners, those types of things. So are these trends expected to continue? This is data from BC climate stations since 1950, and it shows that the historical air temperatures have actually risen throughout British Columbia since that time. So the greatest increase has been recorded in the northern and the interior regions, with averages increasing between 0.3 and 0.5 degrees Celsius per decade. Overall, the overnight minimum air temperature in the province has been increasing faster than the daytime temperature, and the nighttime temperatures are important because this is when people usually have that opportunity to cool off. And when the temperatures don't go down, that opportunity doesn't happen, and so the heat in the body continues to increase. So climate models show that these historic trends are projected to continue. Average winter temperatures are expected to increase by 2 to 3 degrees Celsius, and summer temperatures about the same. So this graph outlines some of the health effects that are associated with extreme heat, specifically mortality, which you can see by the gray bars there. And this is associated with extreme heat event in Vancouver in 2009. So this shows that during the times when maximum and minimum temperatures are high, these are indicated by the two lines there, the two black lines. The number of deaths increased substantially above the average number of deaths during that time, which is this blue line here. So you can see that during a couple weeks in July and August, the number of deaths increased significantly during that time. So usually there are about 290 deaths a week, and during that time there was 398 deaths, so a large increase there. So this here is a graph that shows the exposure to to extreme heat in different areas across Canada. So research that we've done has shown that the environmental conditions at which communities are at risk actually differ among the regions. So these are temperature mortality curves for 5 different communities across Canada. The graph shows the percent increase in mortality with increasing temperatures. So as the temperatures go up, the increase in mortality goes up as well. So as you can see in Hamilton, the temperature at which mortality begins to increase is about 31 degrees Celsius, whereas in Winnipeg, mortality increases around 28 degrees Celsius. So part of this is likely due to regional temperatures. Hamilton is usually warmer than Winnipeg, which allows people to acclimatize to the weather. And so people in Winnipeg are likely less acclimatized to hot weather. Other community and individual factors will also affect this level of risk. But what the graph does tell us that is in most Canadian communities, around 30 degrees, mortality begins to increase. So something similar that was done in the BC region. So this is a study by Henderson and colleagues, and they did a similar analysis as the last one, but again, they focused on BC. So these graphs show relationships between temperature and mortality in 4 regions. So we have the coast in the top left. We have, which this includes the entire coast of BC, including the Greater Vancouver area and Victoria. The dry plateau, which includes some of the Fraser Valley and the Okanagan region. The mountain, which includes east of the Okanagan and Caribou. And the north, which is essentially anything north of Prince George. So just a couple things I want you to take away from this graph. Firstly, you can see that there are what we call inflection points, or temperatures in which mortality significantly increases. And this is different for each region. So the north has the lowest temperature at approximately 14 degrees Celsius, and the dry plateau has the highest at 22. So what this suggests is that when it's hot out and the temperature rises, people in the north are affected much earlier on, and what appears to be relatively normal temperatures. I mean, 14 degrees Celsius really isn't, according to at least Ontario standards, not that hot. So the second point is regarding the slope of the temperature mortality lines. And so here these blue arrows show the increase in mortality with higher temperatures. So on the coast and in the north, there is a much sharper increase in mortality with each increasing degree. So this is also mirrored by the red dotted line here that represents an almost 20% increase in mortality once the temperature reaches 30 degrees Celsius. So that's a little bit background on heat in the region of the West. So who's vulnerable? So several groups have been identified as vulnerable during extreme heat. And this is older adults, infants and young children, people who exercise in the heat, people with chronic illness, the homeless, and those with low income. So in the interest of time, I'm only going to focus on the older adults, and I'm actually going to give some background on why they are vulnerable and practical tips for recognition, treatment, and prevention of heat illness. So older adults are at increased risk for various physiological reasons, and they're listed here. So as mentioned in the last slide, individuals with chronic illness have been identified as a vulnerable group, and a large proportion of people with chronic illness are also older in age. But some additional reasons, they also have a reduced ability to sweat. Older adults have a decreased plasma volume and cardiac output, so their heart can't take the additional stress that comes with exposure to extreme heat. Blood flow to the extremities is decreased, and this is your major means of dissipating heat. Overall, lower fitness, increased body fat, and less lean body mass. There's a reduced thirst sensation there, so you don't feel thirsty as soon, so you're more susceptible to dehydration. And then the increased use of medications. So we know that medications are a large risk factor when it comes to exposure to extreme heat. So this slide provides just a brief overview of some of the risk factors and the complexity from which they relate to each other. So, for example, a lot of the risk factors that are listed here are interrelated. So you can see that a person on medications is at a higher risk for developing a heat illness. But when you couple that with someone who suffers from chronic illness, which is often the case on people on medications, they have an even higher risk. And then someone that has all three risk factors are actually at the highest risk. So you can look here at the list provided. You can easily understand why the risk factors are so closely related and have compounding effects. So there are physiological risk factors. There are also other risk factors that are associated with living conditions. But then there are also risk factors that increase a person's susceptibility to heat morbidity or heat illness. And those are things like obesity, alcoholism, dehydration, previous sunburns, or a history of heat illness and stroke, among some other things. So this is a study by researchers at the University of Ottawa, and they investigated the physiological effects in older adults. This is people who are 65 years and older, and they exposed them to extreme heat. And they also looked at their younger counterparts which were adults around 21 years of age. So these results here are following only a 2-hour exposure, and it was in a hot, humid condition. So the temperature was about 36 degrees Celsius, and the humidity about 60%. So these are conditions that are typical to Canadian summers, and they were actually during the heat wave in 2009 and this summer, these conditions were actually reached and measured in BC. So what does this show? The figure on the left here shows the increase in core temperature during the exposure period. So the white circles are older adults, and the shaded circles are the younger adults. And after only 2 hours, you can see that there is a significant increase in core temperature in comparison to the young adults. And after 30 minutes, where this red arrow is here, there's a clear, and again, I mentioned this before, what we call an inflection point. And that's where the core temperature steadily rises from that point onwards. So if this exposure was to continue for 8 hours, so such as the case of an extreme heat event, core temperature could actually increase by about 1.5 degrees, more than the younger adults, which is about 2 degrees Celsius higher than regular resting levels. So this actually has serious implications for developing heat illness and may explain why an older person is a little bit more susceptible. Now on the right, this bar graph here shows the amount of heat stored within the body in the old adults following the 2-hour exposure. So after only 2 hours, there was significantly higher body heat content. And this is heat that's stored in the fat and the muscles within the body. So like I had mentioned before, another reason for older adult susceptibility is the daily use of various medications. So I did some research on Stats Canada, and I found out that nearly all residents of healthcare institutions are currently medication users. And when surveyed, about 97% of them had taken some sort of medication in the past 2 days. So multiple medication use, which was 5 or more different drugs in the past 2 days, was reported in 53% of seniors in these healthcare institutions, and 13% of those in private households. So on top of that, in 2005, pharmacists dispensed on average 35 prescription drugs per person aged 60 to 79, and 74 prescription drugs per person who are 80 and older. So these numbers are really important as they relate to the increased risk during a heat wave. So this graph here highlights the increased risk from particular pharmaceutical families. So, for example, you can see here the patients taking antipsychotics, which is the blue bar, were almost 5 times as likely to die from hypothermia, and those on anticholinergics, which is the orange bar here, were almost 6 times as likely to die than other seniors who were hospitalized during a heat wave. So medications can exacerbate the effects of heat for several physiological reasons. So the hypothalamus and the body temperature set point is off. So when the body perceives heat, is not necessarily controlled very well. Your sweat rate is different. It can be lowered. Your renal function and your general body hydration can be offset. And then you can also be susceptible to radiant heat or things like UV exposure. So this table here provides an example of some of the information as they relate to medications. So I realize that there's a lot of information here, but this is simply meant to be illustrative. For a completed table, it can actually be found in our extreme heat event guidelines, and I'll describe that a little later. And again, I think Agnes may have some there in the room, and you can also order them online. But for various drug classes here, you can see the general side effects that should be monitored during a heat event, some general recommendations for prevention, and then some specific recommendations for that particular drug. So another risk factor that I'd like to highlight is social isolation, and it's relatively known that this is an emerging issue, especially among seniors in Canada. So social isolation has been identified as a prominent risk factor for developing a heat illness. So these can be people who live alone, people who don't have regular visitors, or people who even don't leave their home on a regular basis. So the evidence that exists in the literature demonstrates that the extent of a person's community integration and social network involvement is related to their health status. So a lack of social networks has been associated with increases in a lot of unhealthy behavior. So things like alcohol overconsumption or and something like that can contribute to dehydration and even impaired judgment, especially during a heat event. So not leaving the home can be a problem, even though the residents can be very hot and uncomfortable, and cooler options can be available elsewhere. This actually extends a person's exposure to heat unnecessarily. So this may be due to the inability or unwillingness to visit cooler areas, so places with air conditioning. We've talked with people, a lot of people, say that they don't feel comfortable at the community center, or they don't have the transportation to be able to get there. So these are issues that communities, when it comes to a heat event, really need to deal with. So for this reason, we say it's very important for facilities, especially long-term care homes, to have a cool room or an option for residents. But then also, if you have seniors or friends or family members who don't live within a long-term care home and live alone, to visit them frequently to make sure that they're cool and hydrated. So these types of studies in older adults have important implications for the future and emergency planning and responses in Canada. So the percentage of the Canadian population 65 years and older is actually expected to double in the next 10 years, or in the next 50 years, sorry. But even within the next 10 years, it's supposed to go up by about 20%. So this is going to create additional pressure on the healthcare system and may increase capacity issues when a heat event actually does occur. So in BC particularly, although in comparison to the rest of Canada, the proportion of seniors in BC is projected to be slightly less than other areas. Eastern Canada obviously has the largest increases, you can see there by the yellow bars. But they're also still expected to have about 24% more. 24% of the BC population will be 65 years or older in the next 20 years or so. So what are some of the heat illnesses to look out for? There are several types that exist, and I've listed them here with the least detrimental first, and then they progressively become more severe. So these include things like heat edema, so that includes peripheral swelling, which is usually in the extremities, heat rash, which is tiny spots on the skin, and they're the result of inflammation caused when the sweat glands get plugged. Heat cramps are characterized by sharp, painful spasms, and they're usually in the muscle of the extremities or abdomen, and they can last anywhere between a few minutes to 2 hours. Heat fainting or syncope, which is heat-induced dizziness or fainting. Hyponatremia. This is a tricky one to diagnose, but it's essentially excessive fluid consumption, so things like water. And it usually occurs in athletes who can consume large amounts of water when they're exercising, but it can also occur in seniors, especially those who are on particular medications. Heat exhaustion is the most common form of heat illness, and it's actually not associated with any organ damage. And then you get into heat stroke, which is classified as a medical emergency and can have really serious repercussions if it's not treated immediately. So in the next slide, I'm just going to describe the differences between heat exhaustion and heat stroke, because these are the two that are the most important, especially when it comes to treatment and diagnosis and prevention. So like I mentioned, this table here highlights the different signs and symptoms for heat exhaustion in comparison to heat stroke. So from a diagnostic perspective, the best way to actually differentiate between the two is by measuring core temperature. So core temperature less than 40 degrees Celsius is considered heat exhaustion, and anything above that is considered heat stroke. However, core temperature is a tricky one because it's rarely taken properly, and proper measurement is actually using a rectal thermometer. So a lot of the time it's not practical. Oral temperature and oral canal temperature, so taking the temperature in your ear, don't actually correlate well with heat-injured patients, so it shouldn't really be relied on. So if you can't look at core temperature and it's not going to be practical where you are, some of the other signs and symptoms are related here. So the onset of heat stroke can be confirmed with the alteration of neurological function. So behaviors, things like confusion, irritability, aggressiveness, loss of coordination are good indicators. If a person has been exposed to the heat and is having seizures or lost consciousness, heat stroke should be suspected, and the intention is that cooling should start essentially instantly. So there are actually two types of heat stroke that I want to highlight here. Classical heat stroke that mainly occurs in older adults, but also in children and those people with chronic illness. So it's accompanied by little or no sweating, and you have dry and hot skin. Exertional heat stroke is a little different. It's an increase in body temperature due to the combination of environmental heat and strenuous activity. So it usually occurs in athletes, but its signs are different in that sweating is present, and it's in athletes and those who have been exercising. So unlikely to happen in seniors, but definitely still something to consider and a possibility. So how do you treat for these two things? Well, heat stroke is always a medical emergency no matter what, and 911 should be essentially called right away. So the two types of heat stroke, however, are treated slightly differently. People with exertional heat stroke, again, like I said, those in athletes and the physically active, should be cooled quickly, and if possible, you use an ice water bath or cooling packs, and you put them places like the groin and under the armpits, behind the neck. On the other hand, classic heat stroke should be treated with a little bit more gradual cooling, mainly because of the type of people, such as seniors, who get classical heat stroke. So you don't want to exacerbate any existing medical conditions. They've looked at ice water baths and whether or not they work in older adults, and generally they're not very well tolerated for obvious reasons. So it's suggested that gradual cooling in that case, and it can be done by the same way. Fanning, ice packs, often with water and fanning is helpful. In both cases, dehydration should be considered, but like I mentioned before, excess water consumption needs to be prevented or at least monitored. So what are some tips for seniors? So I've listed here some common preventative scientifically based messages that will help prevention in the case of an extreme heat event. So first thing to remember is that heat illnesses are preventable. So, taking proper precautionary measures is always a good idea during a heat wave. I mentioned this earlier, visiting neighbors, friends, and older family members to make sure they're cool and hydrated is important. Drinking plenty of cool liquids. We obviously recommend water. And the key here is before you feel thirsty. So once you're thirsty, you've already lost about 2% of your water level. And so by the time you're thirsty, you're already dehydrated. So the trick is to start drinking water even though you're not thirsty. If you do plan to go outside, you can reschedule or plan your activities to cooler parts of the day, so early in the morning or at dusk. Wearing loose-fitting, light-colored clothing made of breathable fabric also helps. If you do feel hot, take a cool shower or take a cool bath, generally until you feel a little bit better. A good tip is not to make meals that need to be cooked in the oven, especially if a person doesn't have air conditioning. So lighter meals is helpful. And then inside you can block out the sun during the day by closing awnings, curtains, or blinds. And then again, you can open them out and let the cool air in at night if the temperature goes down. So a health facility that has many heat-vulnerable clients or patients, such as a long-term care facility, may actually wish to consider planning for the summer and the expected heat events. So there are actually a lot of provisions that can be put in place to prepare for the summer, and I've listed some of them here. So having an updated extreme heat emergency plan, and this can actually just be put into your existing emergency plan. It doesn't have to be anything elaborate or new. Educating staff and training them on heat-related illness before the heat season occurs in the spring is always an important component. Make sure that they're aware of the signs and symptoms, and if you do have any protocol, what it is, which brings me to my next point, which is inform staff about your heat emergency plan. So a lot of the times there are staffing protocol or particular clients have very specific needs, and to know those and keep those into consideration. Awareness of public cooling options is good. Usually communities during when a heat alert is called will have cooling options within the community center or a library or a church that can be used. And then again, during an extreme heat event, reviewing this information with staff and residents is always important, and reviewing the clinical management of those most at risk. So like I mentioned before, people on chronic illness or certain medications, or even people with low mobility to get to a cool area. I think there was actually some newspaper articles saying that in the recent heat event in Toronto this summer, there were a couple long-term care homes around the third and fourth floor. Temperatures reached up to 50 degrees Celsius, which is obviously not acceptable. So provisions to take into consideration the clients who reside on that floor. So some more facility preparedness here. These are more practical recommendations are listed here under the 4 key themes for facility preparedness. So cooling measures, look at your indoor heat, block direct sun, increase airflow. If you don't have AC, if you do have AC, use it. Staff education and protection, so education and training on heat illnesses, but then also on emergency plans. Facility maintenance, so keeping it cool and comfortable as best you can. And then if you do need to evacuate rooms if indoor temperatures are too high, or even providing just one cool room is always a good idea. And then patient and resident care, so make sure that there are cooling supplies available on site, cooling areas. Keeping medications cool is an important one. Avoiding food spoilage is another one. And having meals with a high water content can also always help, especially for people who don't drink enough water.
Then I could just put it on speaker. I have a headset, but there's no place to plug it in.
Sorry, if there are people on the line, we please ask that you mute the line because we can hear you all here. So just to continue, an emergency heat plan or protocol does not have to be created from scratch, like I mentioned before, and specific provisions can be integrated into an existing plan. So it's important to review the plan with staff prior to the heat season, and any protocols that are necessary. So what happens if a blackout or a brownout occurs? So I've listed here the very basic but important considerations. And I think for the most part, I've gone all over all of these. This is just to reiterate, again, some things that an emergency plan can contain. Some things I guess I'll highlight here is if considerations for increasing contact with isolated people, if they're at home, or if they have low mobility and they can't get to a cooling facility. Identify a need for backup generators if there's a possible power outage. I think right now we are on the 10-year anniversary of the power outage in Ontario, 2002. So it's important to have those types of things considered. And then another one is to manage employee heat exhaustion. So often, everyone is so concerned about their patients and what to do with them, that they forget that the employees are also in the same conditions. They're running around, they're hot, they're tired. And so having a plan to manage employee heat exhaustion and work rest cycles is always a really important consideration. So I wanted to mention here a little bit about air quality, mainly because days with high heat levels are also accompanied often by high air pollution. So monitoring the Air Quality Health Index, or the AQHI, in conjunction with the temperature and humidity can be useful for people considered at risk, especially since those who are vulnerable to extreme heat are usually the same people vulnerable to high pollution levels. So just a little bit of background on the AQHI here. So the AQHI is a scale designed to help you understand what the air quality is around you and what it means to your health. So the index pays particular attention to people who are sensitive to air pollution and provides them with advice on how to protect themselves when the air quality levels are low, are medium, and then are high. And they're outlined here in this bar here. And they range from 1 to 10 and 10 plus. And so this is a snapshot of the Air Quality Health Index in Metro Vancouver earlier this week. And so generally, I mean, air levels in Vancouver are generally pretty good. They're like here in Ottawa. So essentially, the higher the number, the higher your health risk associated with the air quality. And then it provides messages that are customized to each category for both the general population, but then also the at-risk population. And again, you can get your hourly readings and maximum forecast values for today, tonight, and tomorrow. And I've included the link to the AQHI website, which is www.airhealth.ca, and you can get the readings for your particular region. So to aid in the health sector planning for extreme heat events, like I had mentioned before, and Agnes was kind enough to bring along with her, we've developed a variety of tools and information resources to help. So I'm going to talk about some of these, those that are specific to the health sector that may be of interest. But like I mentioned, all the products can be ordered off the Health Canada website free of charge. So targeted fact sheets are a good means to address many of the issues in a very concise manner. So there are actually 3 fact sheets available. We have acute care, which is shown here, and that covers the recognition, treatment, and prevention of heat illness. We have community care, which was developed for community healthcare nurses that visit the home of patients or clients, often those that are socially isolated or at high risk. And so it contains things like, you can see here at the bottom, a checklist when visiting a client. So things to look for during an extreme heat event that may be an indication of a heat illness. And then the third fact sheet is for facilities preparation, and it contains provisions and also a checklist to prepare a facility for an extreme heat event. So a lot of the information that I went over before is actually captured in this double-sided fact sheet for easy access. We also have brochures for vulnerable groups, and we have them for different at-risk audiences. So we have the older adults, the physically active, and then for the parents of young children. And these things are ideal for providing to patients during consultations. They're really nice, good brochures for essentially for the general public, and it explains your risks and some prevention options. We also have the Extreme Heat Event Guidelines. This is a technical guide for healthcare workers, and it's an evidence-based resource. It has a large amount of information regarding the risk and impacts from extreme heat events. So the guidelines contain practical information for the recognition, treatment, and prevention of heat-related illnesses, and a lot of the information that I went over today is found in this document. There are also prevention and mitigation strategies for healthcare providers and health facilities, and then the identification of possible community risk factors and emergency preparedness activities are also outlined. So this is actually quite a large document, and it contains a lot of information. So we also have an extreme heat event user guide, and this is more for healthcare workers and health administrators, and it accompanies the technical guidelines, but it highlights essentially key messages and concepts. So it also provides information for health administrators and healthcare workers to identify opportunities for integrating activities to reduce the heat health risks into work and then into planning, as well as it helps facilitate the exchange of knowledge among healthcare providers and the public. The nice thing is that healthcare providers are such a unique source and trusted and respected source that talking with your clients or with patients about environmental health issues coming from, these people are always a good opportunity to get these types of issues into the forefront. And then finally, like Agnes had mentioned, in partnership with the Ontario College of Family Physicians, with McMaster University and the Clean Air Partnership, we actually developed an accredited course, and it's online for health professionals. The nice thing is that there is a health professional component, but then there's also a component for the public that provides some additional resources that are meant for the public. So people or individuals who complete the online course will receive physician continuing education credits. So it's Main Pro accredited, which is great for those who need continuing education credits. It's also endorsed by the Canadian Nurses Association. So they also recognize it. Although they don't have credits, they recognize it as an important course. So this here showcases the course main page, and it illustrates the resources, like I mentioned, available both for the public and healthcare professionals. And the healthcare professional page is where the course can be found. And this is available in both French and English. So in English, the link is here, extremeheat.ca, but it's also available in French at chaleursaccablante.ca. So we'd like to actually hear from those of you who are online or who are in the room. If you've ever used any of the heat health products by Health Canada, we've developed two surveys, or one survey in English and in French, that is going to take into account, how you've used this type of information and how you've incorporated it into your professional activities. And the intention is to take this information and use your feedback to develop further types of projects on climate change issues and whether or not, particular tools are more useful than others. And essentially, we want to hear what you're looking for so that we can help tailor what we do from a climate change perspective. And then finally, I just wanted to add one more information project. I realize it's not extreme heat, but it's related to climate change. And I added this because I thought it would be interest for health facilities for preparing and building resilience to climate change impacts. So Health Canada, in conjunction with the Canadian Coalition for Green Healthcare, has developed a healthcare facility climate change resiliency toolkit that healthcare facilities can use to assess their resiliency to climate change. So the toolkit includes a checklist with questions in areas such as emergency management, facilities management, healthcare services, and supply chain management. So the toolkit, I've added the link there. It's available online on the Coalition website. And again, it can be accessed free of charge. So there's actually three particular different components to the toolkit. So a facilitator's guide, the checklist like I had mentioned, and best practices and resource guide. So the facilitator's guide has information on how facilitators can use the presentation, benefits of assessing healthcare facility resiliency to climate change, an introduction to climate change impacts in healthcare facilities, as well as information on how to complete the actual checklist. And then the checklist consists of a series of questions that pertain to key resiliency areas. And again, like I mentioned, and then it will direct you to various best practices and resources that you can use to help address some of the issues that or challenges that your facility may have. So I will stop there. I put up my email address here if anyone has any further questions. I'd be happy to answer them offline, or I guess I'll take questions now. But then I also put up the link to our online publication. So everything that I mentioned today, again, is available online. It'll be sent to you free of charge. We have them both PDF as well as hard copy, and they can be ordered in French and English. So I put up the English link there. The French link should be easy to get to from there as well. But again, if you need it, I'll be happy to send it to you. So I guess I'm not sure, Gloria, do you want to facilitate questions, or if there's any questions in the room, I'll take them, and I guess we'll then go to the phone lines as well.
Because, what I think we want to remember is that at any point in time, about 95% of the 65 and over population are living at home in the community.
Right.
So from the point of view of where you work, are there questions or issues that you want to bring up?
In regards to older adults living in the community?
We have a gentleman with a question here.
I think in a way, for people living in communities, the policy could be taken up with the health authorities or the local health units so that they have a high awareness in making visits and taking a list of people that might be exposed to such risks. So it has to be a bigger policy, a more kind of connection with the healthcare providers as well.
Absolutely. That's an interesting...
Repeat we didn't hear the lady's comment or the man's question. Would you be kind enough to repeat the comment and question?
Sure. The first question from Gloria was just to mention if I had any, if I had anything to say about the fact that most seniors in the community, 95% of the seniors in the community, are actually found at home and not necessarily in long-term care homes. And then the comment by the gentleman was saying that there needs to be more of a connection between the health authorities and healthcare providers and the seniors in the community so that there's more communication between them. And I was just going to mention on top of that, the health authorities are the organizations who give out the heat alerts or the heat warnings when there's a heat alert response system. And so a lot of them have connected with these types of partners in public health and different organizations who do have outreach to seniors in the community. And so there are particular organizations such as places like Meals on Wheels who deal with a lot of seniors who, will have during a heat wave, will make sure that they knock on the door and wait for somebody to answer. And they have these types of plans, I guess, in place to raise awareness. And then another thing I guess I would mention in regards to communities, seniors in the community, is that's why we highlight so much that we should, if you have family members or neighbors or friends, to raise this community awareness and go check on them during a heat event fairly regularly. Once a day is not necessarily enough. A few times a day to make sure that they're okay, to make sure that they can go someplace cool if they have family, that they can go visit, things like that. Because Gloria's right in that there are a lot of seniors within the community, not necessarily in long-term care homes.
Yeah. Well, certainly in the European heat wave, what came out loud and clear, and this is wearing my hat as president of the International Network for Prevention of Elder Abuse, was that people were afraid of being victimized. and so they stayed in their homes with their doors and windows closed. So some of that kind of very basic messaging needs to go out. But Christina, I noticed that you say your products are available in English and French. What about in reaching the ethnic communities?
Right.
Do you have plans? Because like in British Columbia, we have a large Asian population, a large population from India and related countries. Are there going to be any opportunities, or are you planning to do things for the ethnic communities?
Right now, we don't have any immediate plans to provide our information products in other languages beyond English and French. But all that to say, Toronto Public Health actually has a very large heat program, and they obviously have a large ethnic community in Toronto as well, and they have basic information products on extreme heat that are in multiple languages. So I would encourage people to visit the Toronto Public Health website, and they have I would assume almost 15 to 20 languages they have these products in. So unfortunately, we don't have the funding to be able to do that, but Toronto Public Health, who deals more closely, would. But I just wanted to one little comment about people staying in the homes in the Chicago heat wave in 1995. It came out that the same type of thing. People were afraid to leave their homes, but communities that were very integrated and that had very large social networks, they didn't have the same high death rates as communities with the population that generally kept to themselves, which is why when I had mentioned previously about social isolation, that a larger social network, even with just friends and family, is always a good thing when it comes to health, I think, in general, but then especially in the case of an extreme heat event. I do have one quick question here online from Angela in northern BC, and it says, I remember working in our hospital, very pregnant and being gowned and gloved. It was 40 degrees Celsius inside. Are these precautions, response tips ever going to be mandatory? And I guess the tricky thing is in regards to occupational health and safety, it's more a provincial jurisdiction, and so unfortunately Health Canada doesn't make these regulations. All that to say, there are work rest cycles that the American College of Industrial Hygienists, the ACGIH work rest cycles, do have those types of things in place. So if it's 40 degrees Celsius, for example, and you're working at a moderate activity level, you should be taking a break every 20 minutes. This is obviously just off the top of my head, but it's definitely something to consider, and we do encourage organizations to look at these and to take something like that into account in their facility as well.
Seeing that some medication is very adversely affecting seniors in heat situations, shouldn't there be some sort of provisions that either the prescribing physician or the pharmacist should warn seniors of the negative effects in heat situations of drugs?
Yes, absolutely. It's a difficult one. We've looked into it a little bit here in our office about how exactly these types of warnings and labeling precautions can be put and how they're generated on particular medications. Talking with pharmacists, generally some of them say, well, we are aware of the medications that can put a person at risk, and we'll tell them, but very rarely do they actually have them on that little printout sheet that you get with your medication. So it's something that we're looking into and that we're definitely aware of. The issue being is that the connections are not entirely clear, and essentially, medications when they go through their testing phase don't necessarily look for complications from an extreme heat event. So there are challenges there that need to be addressed, but what we're trying to do instead, or for the moment, is through this course that we have, is to raise awareness among the health professionals and among the pharmacists. So although it's not necessarily on the warning labels on the exact medication, at least the pharmacist, when they talk to their client or their patient, can point these types of things out.
Okay. We have another question here.
Yeah, thank you for sharing your knowledge and experience. My question is about people who drive cars during this extreme heat situation. Should they drive cars, especially I'm referring to seniors? And the second question is temperatures during the winter time, because I think there are thermostats that often don't work even. So I wonder what is the impact of heat on seniors during the winter time, indoors?
That's two good questions. So in regards to driving a vehicle, I'm obviously not an expert in senior driving and provincial laws, but my educated guess would be that I think most vehicles nowadays are air conditioned. So I realize that they will contribute to GHG emissions, which would then can contribute to air pollution and climate change in general. But to completely prevent from driving, I'm not sure I would recommend that, mainly because for two reasons. One, if the vehicle is air conditioned, at least it's an opportunity to cool down. And two, I don't think we want to limit seniors' ability to go out and seek those areas that are cool. We don't want to inhibit them from going to the community center or going to the church or the library or the mall to cool down. So I think driving is a major mode of transportation for some people, and maybe not for all seniors, but for some, and I don't think we want to limit them from going places if they're going to go cool down. We could always recommend, not to do any unnecessary driving, but I wouldn't inhibit it altogether. And then the second question in regards to indoor air temperatures during the winter and thermostats not working, my recommendation would be to, if possible, have a thermostat that does work so that you're aware of the different temperatures in your home. But, if it is too hot, you can always take into account some of the same messaging that we've provided for the summer. There is not a lot of research that talks about going from a very hot environment to a very cold environment. So indoor temperatures can be very warm, but I don't think there is a huge risk if you were to be inside in the warm home and then go outside into the cold, into the snow. So if it is too hot in the house, again, a lot of the same types of things can be taken into account, like drink lots of water, wear loose-fitting, light-colored clothing. You can close your blinds during the day. I think all of those messages are still worthwhile.
Are there questions from the people that are connected online? All right. If not, Christina, you did in your presentation list amongst risk factors people that have cognitive impairment. And I know this is something of interest to Tina Love, who is here with us. And so I'd like to ask her to comment.
Well, one of the things that we consider and look at too, or think about, if someone has cognitive impairment, quite often their dress is inappropriate. And again, particularly, I guess, if you're looking at your socially isolated seniors, that they might be sitting in their apartments, like Gloria said, they're afraid to go out, they're afraid of for security to open up, but then they're also sitting in there with layers of sweaters or their winter coat on, or even just watching that they head out of doors, the ones that do go out. So again, I guess as a risk factor, the cognitive decline from inappropriate dress and just the not realizing that they're too hot or that there's a danger.
So the question that leads from that is whether Health Canada has been working with groups like the Alzheimer's Society. And if not, if there is an opportunity, perhaps that should be explored there, because we know that dementia is a significant problem within the seniors population.
Right. I think we haven't worked with them thus far. Through our accredited course and some of our outreach activities, we do try and get out to various conferences and workshops where these types of organizations would be present. So, for example, I was out in Kelowna in April for the Community Health Nurses Conference. But then we were also at the conference, Gloria, that you run, the Gerontology conference. So opportunities like that is where we try and reach those types of audiences. In addition, our accredited course, we do go through various different organizations to promote it. So, for example, we have endorsement by the Canadian Nurses Association, and it's main pro accredited, which is the College of Family Physicians of Canada. But if an organization, for example, like the Alzheimer's organization, would be interested in promoting or endorsing the course, we would obviously be happy to have them do that. And then the other option, I guess, like you had mentioned, is there a possibility to do that? There are various means. We do workshops, kind of like this one, where we tailor them to various issues that are surrounding particular climate change issues and in different regions, and we'd be happy to explore options like that with organizations that do feel that this type of information would be beneficial to their partners and to their members.
Okay, we have another question.
Thank you, Christina. In your presentation, you mentioned about people with mental condition. Does the study include people with addiction?
Sorry, with addiction?
Yes.
Okay.
Yeah. The second question is, will this PowerPoint deck be available on your website? And can this be used for community education?
Okay, all good questions. In regard to mental health issues, addiction is something that hasn't been strongly looked at. There has been some studies in regard to drug use, and it's been found that there is an increased risk with recreational drug use. A study out of Montreal in the 2010 heat wave. Mental illness is a tricky one because it's not, when someone presents themselves in the emergency room, it's not something that's really recorded as a chief complaint. And so it doesn't often get rolled up into the health data that we look at. But in Montreal, there was a study that came out that looked at mental health specifically and found that there was a high incidence of death among those with mental health issues. But then also the issue with mental health is that a lot of these people don't necessarily go to the emergency room or go to their doctor or a healthcare provider. So a lot of it just goes unrecognized and unrecorded. In regards to the PowerPoint, I believe, Gloria, you are going to have it posted somewhere.
It's on the SFU Gerontology Research Center website. That's why we're filming it today. So we'll have it posted there so you can access it, or your colleagues as well.
Yeah. So if you do want to use it for community outreach, there are particular slides. I think if we didn't want them cited, I think it would say so on the bottom. Otherwise, all this information is publicly available, and you can use it to your discretion.
Another question is coming for you.
Christina, can we translate it?
Can it be translated? We can definitely have it translated into French. It might be a little bit more difficult to have it translated into another language, mainly because we have the means here to translate it into French internally, but other languages we'd have to do externally, which would require additional funding, which I'm not sure we have. But if you would like it in French, if you can send me an email, that would be great, and then I can maybe have it translated for you.
Christina, the gentleman had a follow-up question, and the question was, can he go ahead and get it translated to an appropriate language for the community he works with? Can he just do it on his own?
Can you? I don't foresee an issue, but if you could email me with a formal request, that would be greatly appreciated, and then I can reply to you through there. That way, at least we'll just have a record of who it's going to and you know what slides you're going to use, et cetera. And if you wanted me to change anything, I can, or add anything in, I can do that as well.
Thank you.
On the SFU Gerontology Research Center website, there's a new page being developed on the topic of seniors, climate change, disasters. Because, as you pointed out in your slide, a number of the disasters are climate-related. So this is an area in which we have been working for several years. And on that page, we'd like to draw people's attention to a conference that was organized. It was our Friesen conference in 2011 by Heather Stewart and myself, who brought people from a number of different parts of the world to come together and bring our collective wisdom on the issues of the juxtaposition or the relationship between population aging and climate change. Heather, did you want to add any comments? And will the Canadian Study of Health and Aging, with which you are very intimately involved, be doing anything in that direction?
Right. So regarding the Canadian Longitudinal Study on Aging, I think, which is a 20-year study that's going to follow 50,000 Canadians every 3 years, collecting a lot of clinical and biological information as well, has great potential, I think, to study the impacts of changing climate on older adults. In the core data set, there isn't a great deal of data collected, but there's always the potential to overlay climate and weather data with the CLS, say, core data set, or to plan ancillary studies accordingly. And I was glad that Christina ended, or toward the conclusion of her presentation, she talked a little bit about air quality, because if you recall from one of the slides from Kazatsky's paper, particulate matter and ozone also spiked with spiking temperatures. And I think that's really important to try to delineate the mortality and morbidity associated with the air quality, in addition to hyperthermia. Yeah.
Well, the comment about, or the question that had to do with driving was an interesting one, because there is a study that was done in the U.S. and in Canada, which showed that, and I think it was Toronto, that there were seniors who knew about cooling stations, but who didn't go because they didn't want to contribute to pollution. So we really do have to get the message out that you have to consider the different kinds of risks, but when it's hot, get yourself to a cool place. With respect to cooling stations, I guess a common one that you mentioned was the neighborhood mall. In the olden days, when it was hot, people used to take their baby strollers and go to the local grocery store. But it's that kind of very simple message that I think we need to get to the seniors community, that it's not something that has to cost money, it doesn't have to take a lot of planning, but there are, prevention, rather than waiting till you get into trouble. Art, is Costco doing anything specific about getting these kinds of messages out?
Everybody talks about prevention, except nobody practices it, because most instances, the fact after where we get the information, it's after you break your hip that they tell you what you've done not to break your hip. I think that my point would be basically to Health Canada and also to the Public Health Agency of Canada to do more about the question of health literacy for seniors, because that's where the prevention should really take place. I mean, it's great to develop some great models and everything else, but the penetration for these things isn't very great among seniors. And so therefore, I would really suggest very strongly that preventive measures should be given top priority. For instance, you said about the department stores, seniors going into things. Well, since the development of the box stores, that's no longer a possibility, because there are no more any common areas which are heated in the winter and cooled in the summer. So even in terms of planning in municipalities, some of these things should be taken into consideration.
That's actually an interesting point. We do do some work in regards to the urban heat island. So essentially what that is when it's in the city core, it's generally a few degrees warmer, basically because the heat is absorbed by the concrete and the asphalt. But then even at night, the temperature remains relatively high because when the air cools off, these surfaces actually radiate out. And so we're looking into different options that we can do to help decrease, from an urban planning perspective, to decrease this urban heat island effect. So things like increased tree cover and park areas and green roofs. So I do take your note in regards to places to cool off and the general structure of our communities nowadays with box stores and those types of things. So I just wanted to mention that each community often does have its own cooling centers, I guess what we call them. So, for example, in Toronto, when a heat alert is called, transit rides are reduced and movie tickets to air-conditioned cinemas are reduced. And we have a similar thing here in Ottawa. So things like that are always draws. I'm not sure necessarily for seniors since they cost money, but the community center usually has a cooling spot, and hopefully that's accessible to seniors for an option to cool down.
I just have one very small practical question. I know that most of the people that are my generation and slightly older simply are not used to drinking water the way that the younger generation is. And so I really take your point about drinking before you're thirsty, but in terms of just getting the word out, what is a realistic optimal, or maybe not optimal, but a realistic number of glasses of water that people should be drinking? Because I know that the common one of 8 glasses of water a day is so daunting that it just stops people right at the beginning. Is there a number?
You know what? That's a tricky question. I mean, 8 glasses of water is what everyone thinks of when they think of a specific amount. I think it's just because it's so variable depending on, your level of activity, the amount of, how much you sweat, like what you eat, what type of medications you're on. Those types of things make it really difficult to come out with a specific number, which I think is why we say, once you feel thirsty, you're already dehydrated. So I take your point in that it's difficult to drink water even though you're not feeling thirsty. But generally, I think that is the best indication is that, when you are thirsty, have a glass of water kind of thing. And if you can remember, drink a few glasses of water, throughout the course of the day so that you don't get thirsty, those types of things. And sometimes, we do suggest tricks for children, for example, having a brightly colored glass next to the sink or even having just a glass, next to the sink. So whenever you go to the sink, you think, oh, right, I need to drink water. Just things like that as opposed to providing a particular numbered amount.
Well,
I hope that helps.
I think one of your slides did say that people should eat more of the fruit and vegetables and high water content foods. So that's another way of doing it. But,
exactly. Eat some watermelon.
Yeah. Well, I think another point I'd like to pick up on was within your slide presentation was the one about food spoilage. And could you say a bit more about that? Because I think that is another hazard for older people, for people in general in hot weather, and perhaps older people who are not as aware of it as they should be.
Right. I think it's definitely a point, I think, that when people think about extreme heat, it's not something that comes right to mind, which is why we mention it. So, in extremely hot weather, food can spoil much more quickly, especially if it's left out of the fridge. And so, if you think food is spoiled, we suggest that you throw it out and that you not consume it. Essentially, you want to prevent, any gastrointestinal illnesses, which obviously is going to lead to more dehydration if that was to occur due to the symptoms. In the north, it's a large issue, mainly because of the food storage that they have there, their mechanisms. So essentially we just say, if you don't want to leave food out, please don't. And then if you do think that food is spoiled, to throw it away. And it's a larger issue for larger facilities such as long-term care homes too, where they are... sorry, I can hear some additional noise in the background. For long-term care homes who are feeding a large proportion of people.
Yeah, I have 2 points. One is about the issue of preventive program not working. But I think we need, with the prevention slogans like enjoy your freedom to drink water, something very simple can have more effect, because most people don't realize in terms of their freedom to be healthy, to walk to the bus shelter or to go to the mall, because it doesn't cost anything to enjoy those freedoms. And I think we need to have some kind of very attractive slogans to kind of enjoy that freedom. And the second question is about, I live in Burnaby and they have a good new bus shelters. And I think even if seniors can't go to the mall for cooling off, they can go into the bus shelter and sit there. And most of them are pretty nice since they are new. So it's good to at least use it for the next 5 years before they get old. But I think those are, because sometimes it's hard to stand under a tree, but maybe bus shelters would help. And even people who cycle, they should take a break while going into this extreme heat situation.
Yeah, you're right. That's a great idea.
Anybody else in the room with a question? Anyone else online with a question? Last chance to get in. Okay. Well, then I'm going to say thank you very much for being here, for listening to the information we presented, and I'm just going to pass it over to Gloria to wrap it up. And thank you, Christina, to your whole team as well, Anna, and all the others that helped out with this.
No problem. Thank you.
Well, thanks very much, ladies and gentlemen, for coming out today, and we hope that you will go back and spread the message to the networks that you work with and that you are in communication with. So keep tuned. SFU Gerontology very pleased to work with Health Canada on a variety of topics, and do come to our website as well. Thank you. Bye-bye.